Welcome to this Medmastery coronavirus update. I'm Franz Wiesbauer. I'm an internist trained in epidemiology and public health at Johns Hopkins and the founder of Medmastery, where we teach important clinical skills to doctors and other healthcare providers around the world. Today we're going to talk about a recently published opinion piece in the Journal of the American Medical Association, or JAMA, about the characteristics of and important lessons from the COVID-19 outbreak in China. A summary and report of 72,314 cases from the Chinese Centers of Disease Control and Prevention. In this video, you'll learn about the severity of disease, the mortality or case fatality rate, age distribution, and risk factors for dying from the biggest cohort of patients published thus far. So, how did they come up with this huge number of cases? Well, they gathered them from 4 groups of patients: the confirmed cases, the suspected cases, the clinically diagnosed cases, and the group of asymptomatic cases. Confirmed cases are those who are symptomatic with positive nucleic acid test results. Suspected cases were those with symptoms and verified exposures to an infected index case. Clinically diagnosed were those patients with symptoms, exposure, and the presence of lung imaging features consistent with coronavirus pneumonia. Individuals were classified as asymptomatic cases if they were free from symptoms but had a positive nucleic acid test. Overall, 62% were confirmed, 22% were suspected, 15% were clinically diagnosed, and 1% were asymptomatic. Now, I don't know what the rationale was for testing these asymptomatic individuals. One would assume that symptoms would have to be present for a person to be tested, especially when the test kits are scarce. Now, the fact that even just 1% of cases are positive in a situation where we have a severe disease outbreak with test kits needed and used for the sick suggests to me that the true population of asymptomatic cases might be much larger. But we will only know that once we do serologic testing of the general population. Most of these Chinese patients were 30 to 79 years old. Only 1% were below 10, 1% were 10 to 19 years old, 8% were 20 to 29 years old, and 3% were 80 years or older. 81% of cases were graded mild, 14% severe, and 5% critical. So what does that mean? Well, mild cases either had no signs of pneumonia or just mild pneumonia. What about the 14% of severe cases? For the sake of clarity and so you can remember it better, we subdivided the criteria for severe cases into problems of breathing, problems of oxygenation, and radiological problems. So, problems of breathing. They were classified as severe if they had dyspnea, or shortness of breath, or if they had a respiratory frequency of over 30 breaths per minute. So let's turn to problems of oxygenation. They were also classified as severe if they had an oxygen saturation of less than 93% or if they had a PF ratio of less than 300. So what's the PF ratio? The PF ratio is a ratio of arterial oxygen partial pressure, PaO2, to fractional inspired oxygen, or FiO2. In a healthy individual breathing room air, the partial pressure of oxygen measured in an arterial blood gas will be 100 millimeters of mercury. The percentage of oxygen in room air is 21%, or 0.21, so 100 divided by 0.21 equals 500. The PF ratio is a parameter that is commonly used for grading the severity of acute respiratory distress syndrome, or ARDS, which is ultimately the cause of death for most COVID-19 patients who die from the disease. And finally, radiological problems. Patients were also graded as severe when their lung infiltrates, or pneumonia as seen on the chest X-ray, or CT, occupied more than 50% of their lung fields. Finally, patients were graded as critical cases if they either had respiratory failure, septic shock, or multiple organ dysfunction or failure. So what was the case fatality rate? Well, case fatality in percent is calculated as number of deaths divided by number of cases times 100. Overall, case fatality in this cohort of patients was 2.3%. No kids aged 9 years or younger died from the disease. Patients 70 to 79 years of age had a case fatality rate of 8%. Individuals aged 80 or older had a case fatality rate of 14%. The case fatality rates for individuals between 9 and 70 years were not separately reported. No patients classified as mild or severe died. Everyone who died was classified as critical. And if you were in the critical category, you basically had a 50% chance of dying. I would assume that patients once classified as mild or severe could move over into the critical category when they got worse. So it's kind of expected that all patients who died are in the critical category. However, one inference I think we might be able to make from these data is that if a case is severe but stable for many days, they have a lower chance of dying. And what were the case fatality rates in patients with risk factors? Well, patients with pre-existing cardiovascular disease had a 10.5 chance of dying. Patients with diabetes had a 7.3% chance of dying. Patients with chronic respiratory disease had a 6.3% chance of dying. And finally, patients with cancer had a 5.6% case fatality rate. Now, the authors didn't report the case fatality rates for different combinations of risk factors, but it's important for you to understand that these risk factors will add up. We don't learn about the interaction of various risk factors from reading the paper, but it's safe for you to assume that someone over 80 with diabetes will have a higher risk of dying than an 80-year-old patient without diabetes, and that the case fatality rate will shoot up yet again if that diabetic patient also had heart disease, for example. That's it for now. If you want to improve your understanding of epidemiology, make sure to register for a free Medmastery trial account and attend our Epidemiology Essentials course, which will bring you up to speed on things like mortality rates, case fatality rates, incidence, prevalence, and so much more. See you next time.